Dr. David Fisman is a professor and head of epidemiology division at the Dalla Lana School of Public Health at the University of Toronto. Dr. Fisman, good to see you.
Hi, thanks for having me on.
I avidly follow all your tweets to try and understand things on a topic that is very hard to understand. So tell me what you think has to be in place in order for people to feel safe. Is it testing, contact tracing, all of those things? Just give us a sense of what you would be looking for.
So the bedrock, we're going to build a revitalized economy on the bedrock of public health surveillance. That's our eyes and ears. COVID is very sneaky. It's hard to see without doing a lot of testing. So I understand the province of Ontario is going to be coming out with a testing strategy. All provinces need those because what we need to do is, there's this Hobson's choice that's out there, this false dichotomy that we can either have health or we can have a good economy, right? It's not so. What we need is strong public health surveillance and strong public health systems so that we can reopen our economy safely. Because I don't think people are going to be lining up to spend money if they fear for their lives, if they go to stores or if they go out in public. So we need strong public health systems so that we can open up our economy. All the things you mentioned, testing, contact tracing, some degree, as Mayor Tory said, of ongoing distancing are all going to be important, and they work together in critical ways to keep us safe and to keep what we call the reproduction number of this disease below 1. That means we don't have explosive exponential growth of epidemics. So just for an example, we talked about contact tracing a little bit. We need to have few enough cases happening. We need to get that reproduction number low enough that when new cases happen, it's actually possible for our public health units to track down the contacts of those newly identified cases and tell them to quarantine themselves so we don't have ongoing transmission. We can't do that if we're having hundreds of cases a day. So we need distancing to bring us contact tracing. We need lots of testing so that we can find all those cases in order to isolate their contacts. So all of these things sort of interlace and interact with each other to keep us safe. Predictably, yeah, go ahead.
Well, I was just going to say, one of the things that struck me this week was this story out of South Korea, right? This one gentleman goes to a couple of nightclubs and immediately there is a spread of the virus. I realize no one's going to nightclubs in Canada yet, but it does show you how quickly you can have a resurgence of the virus. What does that tell you about what we need to be doing here? Because the advantage that we have, I guess, is that that they are further along than us and they can teach us some lessons.
South Korea has taught us so much. They've been basically a month ahead of us all the way along. They exploded before we exploded. We've learned a ton from them and very directly, and it's created some really direct relationships between Canadian researchers and Korean researchers. But as you say, they're the best or one of the best countries in the world at controlling this, and they're having setbacks. We can predict that what's going to happen in the coming months is we're going to try to open up. We're going to have events that tell us, oh, you've gone a little bit too far. We know that our safety net is distancing. We can always go back to that. We know it shuts epidemics down. So we can retreat to that if we need to. But the way we know how to turn that safety valve on and off is excellent public health surveillance. And that, at this point, is based entirely on testing. So we need a really, really strong testing game so that we can know how far to open our economy and so that we can know if we need to tighten up on distancing, if we've gone too far, if we get a Korea-like situation. Korea's not the only one, right? We have cases back in Wuhan, we have cases in Germany now, we have cases in Singapore. All these places that have done really well are having resurgences, and we will too.
So what would you tell Canadians then we should be doing in terms of testing? I know that Dr. Tam has talked about 60,000 a day. We're nowhere near that, but what should we be hoping for in terms of a goal of testing for us to feel a little bit safer?
I think there are a couple of things. One is when we speak to colleagues in Korea and colleagues in New Zealand, which is another place that's done very well, they have expanded testing tremendously and also controlled their epidemics to the point where they can test whoever they want to test. We still have a situation here in Ontario where sometimes I feel, I'm a practicing clinician as well, and sometimes I feel as though we have people sent to testing centers in order to be told that they don't qualify to get a test. We need to move away from that. As a colleague from New Zealand was saying last week, at this point in New Zealand, they're testing anyone with a stuffy nose. They want to find more. They want to find every last spark in order to prevent the forest fire from starting up again. And we're not close to that in Ontario. We're getting close to that in terms of capacity, but the culture and the public health guidance aren't there yet, and that needs to change, and that needs to change soon.
I have one question from a viewer, if you'll let me, a Canadian who sent this one in, and we thought it was a good one for you to answer, so let's play it now.
Hey everyone, this is Andrew Athey in Toronto. My question is really around the potential easing of social distancing measures when that becomes appropriate. What would a gradual return to normal look like as the pandemic subsides? And how would we avoid provoking a potential second wave of infections? Thanks so much.
So that's a good question, particularly the second wave part. Do you want to address that, Dr. Fisman?
Yeah, I mean, I think we have to look at this as we are about to get up and walk through a minefield, okay? And we want to see where the mines are so we don't step on them. We know where some of the mines are. We know that large gatherings, and Mayor Tory alluded to this, some of the mines relate to large gatherings of large numbers of people. We know that we have issues with congregate settings, long-term care, hospitals, prisons. So we know where some of the mines are, where this thing blows up again. In terms of how we get back as close as we can to some semblance of normal life, I think what we do is we have those surveillance systems there so we can see when the disease is starting to resurge. And that's how we know we've gone far enough, and we're not going to go farther than that. I think, people have shown a remarkable willingness to change their behaviors. I think the public's on the team here. They've shown a remarkable willingness to mask up, which I think is culturally different for us as Canadians, but is probably helping. And I think we need really good, transparent guidance and leadership from public health authorities.
Well, you've taught me a lot, and I'm sure Canadians as well. Dr. David Fisman, thank you so much. I appreciate making the time.
Thanks for having me.